so much for being here. Wellness is the balanced development of the total person and is holistically comprised of 6 dimensions: spiritual, physical, intellectual, financial, emotional, and social wellness. Speaking on one of these areas today is Dr. Aaron Wells. Dr. Wells is an associate professor of exercise sciences here at Brigham Young University. He is also the clinical coordinator for the athletic training program at BYU. He has published and presented in various professional settings and seminars on modality use and the treatment of musculoskeletal injuries, including numerous studies on the outcomes and efficacy of photobiomodulation. Before joining BYU, Dr. Wells was an athletic trainer for the Los Angeles Angels baseball team for 10 years in the major and minor leagues. While working with the Angels, in addition to modality research, he developed mechanisms through which the Angels evaluated pitchers upon reporting for the season to determine injury probability. Additionally, he served as an adjunct faculty at Utah Valley University before joining BYU. He and his wife Tiffani have 4 children and reside in Cedar Hills, Utah. Please welcome Dr. Aaron.
Up here. There we go. All right. I'm not used to wearing a microphone, but there are people on Zoom, so forgive me if I am bellowing out. I usually don't need a microphone, but I want them to be able to hear on Zoom. So I appreciate that introduction. They ask you to send a little bio, and I clearly need to shorten mine and just say, this is Aaron Wells, just, listen to him and try not to fall asleep. I am excited for the opportunity to talk to you today. I have a little bit of experience in this, and I realize when you look at me, you think Chris Hemsworth, you think Ryan Gosling and Aaron, we're basically, triplets, right? With my health. Well, yes, I do have a bad foot, and I've had one for quite a few years, but that actually does make me a little more empathetic and help me deal with some of the injuries, because I can relate to what some of what my athletes have been through. Just real fast, I talked about my background, so I'll just go real quick. The only reason I mention this is just to kind of give you a little bit of background. I'm kind of known here, sometimes even to a fault, as a teacher who teaches anecdotally. Like I have material and facts, but I also like to tell some stories just to kind of give context. So a lot of my stories will come from my background. Again, I graduated from BYU with my PhD, and now I'm a professor here. I also spent time at the University of Nebraska. I like to say it was back when we were really good, meaning Nebraska. I left and kind of went downhill from there. So we'll see what happens. I also spent a lot of time with Los Angeles Angels of Anaheim. I worked with their major league guys during spring training, and then I would go to different minor league affiliates. So like the Bees in Salt Lake is a AAA team. I spent time there, AA in Arkansas, and then even Provo and Orem had a rookie ball level for many years, and I spent time with those teams. And while I was working with the Angels, that's when I would continue to work on my PhD. So I all along, I knew I wanted to go this route, and so it was really good for me to get experience with athletes while I continued, my academic pursuits. I also had the great pleasure of serving as a Pleasant Grove baseball coach. I was one of the varsity assistants and then the JV head coach for several years. And then I still fill in locally, right? In fact, in a couple of weeks, I'm going to go do 4 or 5 games over a 3-day period at Lehigh High School. So I still get a chance to fill in, and that's a lot of fun for me to do. When people find out what I do, right? Whenever people find out I was an athletic trainer, I tell them, when you're watching a sporting event and somebody gets hurt, I'm the guy that goes on the field and takes care of them. And that's what I do here at BYU as well. Now, I don't take care of the BYU athletes. I'm the one who assigns students to go take care of the BYU athletes. So that's my connection with the athletic department. Here, I'm largely, again, a professor who teaches classes, and I train future athletic trainers. So I have the good fortune to be able to send our students out to all the different high schools in Utah County, every sport here on BYU's campus, including extramurals. We send students to UVU, and we actually now have a program called an immersive clinical assignment, where we are literally sending students all over the country to gain clinical experience as they learn to become an athletic trainer. So it's really, really exciting. A lot of the questions I get asked, right, even by neighbors, friends, students, once they find out what I do is, when should I ice? What's the deal with ice? Is ice as good as they say? How do I treat a sprained ankle? And I get questions about a lot of injuries, but certainly sprained ankle is probably the most common. I get this one an awful lot. Hey, I sprained my ankle months ago. Why does it still hurt? Like, is it ever going to get better? When will the swelling go away? Is stretching too bad for you? And probably the most common question I get is, do you know Mike Trout? He's a former Angel. Well, he's not a former. He's an Angels player. And just so you know, no, Mike Trout was after my time. I'm a Vladimir Guerrero. He was the guy that I was with the Angels. He was my guy. So today, by the way, that was a quasi name drop. I apologize. The goal for today is to talk a little bit about what we do immediately following injury. And I'm not going to get too technical. I'm not hopefully going to be too boring. But I do want to talk about some basic fundamentals, some basic principles, maybe dispel a little bit of myths about, maybe why we do certain things. I'm going to discuss some simple things that you can do to stay healthy musculoskeletally. And I'll be perfectly honest, I'm like maybe 8 out of 10 confident that musculoskeletally is actually a real word, but I like it, so I use it, musculoskeletally, right? And then we're going to talk about some preventative techniques like warming up, cooling down, and I'm going to answer some questions or pose some questions about stretching and then answer them. So again, these are the things I hope that you take away from today, right? I want you to have a better understanding of how to take care of injuries. We're going to know the difference between sprains and strains. So when you have an announcer on TV and they say he's out with a strained shoulder, you're going to be like, that doesn't make any sense, right? We're going to talk about how to use ice and when. Hopefully you'll leave here going, inflammation is a good thing, right? I know that sounds totally weird. We take anti-inflammatories, but if it wasn't for inflammation and the inflammatory process, we would not recover. So believe it or not, inflammation we don't necessarily like some of the outcomes or some of the side effects, I should say, but we love the outcomes, right? Inflammation helps us heal. What does stretching actually mean? Like there's different types. And then again, just give you some simple principles of stretching. And I want to end today talking about the SAID principle, which I think is it's a great principle for us to use. Our body uses it, but I believe that's actually a principle that Heavenly Father uses as well for us spiritually. So we'll end talking about the SAID principle. I have a video, should come through here. The first one here, let's look at a sprained ankle. So let's see if we can clip on this. Okay, 1 second. Let me turn that volume down real fast. And how can I get that to show over here? Is there a way? Sorry. Yeah. Oh, there we go. See, this is, again, I have trouble at home. I can fix your shoulders, your knees, your elbows. Anything electronic or mechanical? No, that's my kid's job without a doubt. So this is not, this is sprained ankle, but I'm not going to show anything totally gross. It is gross, but not horrible. So you watch it and you're like, what? He's playing tennis. Like, how bad could it really, really be? We're going to watch the replay. He's not being wimpy. Yeah, when you can check to see if you have gum on your shoe without taking your shoe off, it's not a good, it's not a very, very good thing. All right, so let's pause this. Let's drag it out of the way here. There we go. Oh, let me take it further so I can see. Actually, let me just close out of it. Okay, so that just happened. So what do we do? Well, first of all, let's talk about a sprain is something that happens to a ligament. A strain is something that typically happens to a muscle or other connective tissues, right? So we're dealing with a sprain. We're probably dealing with the strain of some musculature as well, the body trying to prevent that excessive internal rotation, but we're going to focus on the ligament there. When people have this happen, right, these are some of the misconceptions. I hear people say, oh, no, and I played church ball forever, right? That's why I kept spraining my ankle, which is why I eventually had to have my ankle fused after multiple surgeries. People say, no, leave your shoe on because it's going to get, it'll swell up like crazy. Leave your shoe on, right? Don't take your shoe off. I've heard people say, hey, get up and walk it off. If you get up and walk it off, if you can walk it off, it's going to help. And by the way, I'm not saying that they're wrong when they say these things, right? They're not 100% right either, in my opinion, but I understand the logic. I hear people say, let's get some ice on it. And I'm like, yay. And then they're like, yeah, but don't put it right on the skin because that's really bad. And I'm like, boo, that's not, you can't put it right on the skin, I promise you. So again, what is the right way to take care of this? And let's say that, this could be an ankle sprain. This could be, you're working outside and, somebody hits you, you're cutting branches and a branch falls into your leg, some type of a musculoskeletal injury. But, a lot of these rules will apply to soft tissue injury. Click back on this again, so it will go. There we go. Okay, so I want to introduce you to a topic, and probably some of you know this, right? This is nothing new. We're not reinventing the wheel here. There's this concept called RICE, which is extremely basic, but it's very, very effective, right? Just because it's basic doesn't mean that it isn't great. It works great for sprains and strains. So it's rest, ice, compression, and elevation. So the next 15 to 20 slides, I want to focus on this concept of RICE and what exactly it means, okay? So the first thing, the R, is rest, right? If you aren't able to get back up and play, and that's why I say one of the first things we do is we listen to what our body says. That's why we have pain receptors. When I was, I don't know, 8, 9 years old, I remember hearing about these twins that were born with no pain receptors in elementary school. And we were like, that's amazing. Oh, that'd be so sick. You could jump off your roof. And they were like, well, how would you know if you broke your legs? And we're like, oh, I guess that's a good point. Like, we need to have pain receptors. So listen to your body, right? And if you cannot get back up and play, if you don't feel like you can, then listen to that. But I want to talk real fast about this thing called Ottawa ankle rules, right? Because there are some things that you can do to help determine whether or not you need to go get an x-ray. First of all, let me say that there's nothing wrong with going to get an x-ray. I had this plan in my head as if I had an athlete who suffered an injury and I needed them back within a certain amount of time, right? Let's say that it was a NFC championship game and we were going to play in the Super Bowl. I was in baseball. So if it was the ALCS and we needed them to be ready for the World Series, what would I do? One of the first things I would do regardless is get an ankle x-ray, right? If they sprained their ankle, because I wanted them to know whether they could, get in their head and get in their mind whether they're going to be able to play or not, right? So I understand that there are certainly reasons to get x-rays, but a lot of times it's like, well, can I afford it? How much is my insurance going to be? Do I want to go wait in the waiting room? Do I want to go deal with that? So the Ottawa ankle rules are really 4 nice little steps that you can do to help determine really whether you feel like you should go get an ankle x-ray. And so I call it the 4x4. We have these 4 areas that stick out right in your ankle. On the lateral side or the outside, we have our ankle bone, right? We call it the lateral malleolus. It's part of the fibula. On the medial side, the tibia, it kind of sticks out as well. If you go down, you have this navicular bone, which kind of sticks out also. And then you have the base of your fifth that sticks out as well. They're kind of the prominent spots that stick out. If you touch those 4 areas and they're point tender, they're pretty painful, right? In those areas, I recommend you go get an x-ray, okay? The other thing is, the other 4x4, right? The other part of 4 is, can you take 4 steps in any direction? Now, if you look down and your ankle is, bent completely, or you're in excruciating pain, I don't recommend getting up and walking it off, right? But I'm saying if you're like, oh man, it's sore, but I think I can walk. If you can take 4 steps in any direction, the great chances are you do not have a fracture, okay? So if you're ever wondering, man, do I need to go get an x-ray? Do this little 4x4, right? Find these 4 palpable areas. They're the parts that stick out, 2 on the inside, 2 on the outside, or 2 on the medial side, 2 on the lateral side. And if they're not point tender, and you can take 4 steps. Now, I don't mean 4, stomping steps. I mean just 4 steps in any direction. You probably don't have an ankle sprain, probably, right? Just by following the Ottawa ankle rules, they've estimated that they have saved about 30% of the population from getting unnecessary x-rays. Now, again, if you go to an x-ray, that's perfectly fine. But, as somebody who pays health insurance and has to pay co-pays and stuff, we understand why LeBron James gets an MRI when he has a hamstring strain, because, he's worth hundreds of millions of dollars. Most of us don't need to do that. Most of us can't afford to go do an MRI every time we have an ingrown nail. So we need to make sure that we have, and that's not a knock on LeBron. That's just, professional athletes, right? They're a different, level of care because of the financial implication. Most of us have to worry about paying for our health care. So just those simple 4 procedures, right? The 4x4, the 4 palpations and the 4 steps can do a great job of helping you identify whether you need to go get an x-ray. Now, let's move on to the ice. And I'm going to spend a little bit of time on the ice because I think it's really, really important. And I think it's largely misunderstood. How long? It depends, again, on the type of cold, right? So if I'm using an ice pack, and you say, what do you mean types of cold? Well, I have just general crushed ice, right? I have gel packs, right, that are reusable. I may have a cold spray, right? I may have a cold tub, right? An ice bath or something. So it depends on the type. It depends on whether you are directly contacting the skin. So if I have an ACE wrap helping with swelling, which we're going to talk about next, I need to adjust my ice time, right? Does that kind of make sense? Because the whole purpose of icing is to do what to the tissue? To make it cold, right? So if I have something blocking the cold, it would make sense that I want to increase my time. That seems fairly logical, but I promise you there are many people out there who, for some reason, that logic doesn't really connect, right? If the whole goal of ice is to get the area cold, then I probably want to get it cold, right? That's just me. Okay, we don't have, okay, let's ice down the sodas. Okay, we'll put the ice there, but just put the sodas next to the ice because we don't want to get them too cold, right? No, we put them inside the ice, right? And that's what we need to do with our body. I do want to say the ice is very safe, like crushed ice. I have no problems. It's perfectly safe. And don't get me wrong. I'm not saying that using like a gel pack is unsafe, But if you reuse an ice bag or you use the gel packs, there can be condensation, and that actually can cause frostbite, right? So if you're using a gel pack, make sure there's no snow or condensation on it, wipe it off. And I still, on the gel packs, I might even pull back just a little bit on my time. And again, the general rule is 20 to 25 minutes, right? That's the general rules of ice application. Now, I mentioned body part, right? If I'm icing my quad or an area that has a lot more tissue, let's say that I have a hamstring strain, right? I'm probably going to ice that 25 minutes, maybe even a few minutes longer. If I'm icing my knee, fairly bony, even in a big guy like me, my knee is fairly bony, I'm going to do 20 to 25 minutes. I'm not going to exceed 25. And by the way, I know athletes who are so committed to getting back that they're like, no, I'm just going to ice it all night long. I can tolerate it. No, at 20 minutes or so, 20 to 25 minutes, you need to take it off. Just because 25 is good doesn't mean 45 is great. I know people that have fallen asleep with their feet in cold tubs and they've woken up with, some problems, some ice burn. I had an athlete, a BYU wrestler actually, back when we had a wrestling program, kind of shows you how old I am. We iced his knee. We were up in Oregon and we iced his knee. And every time I give ice, I hold up the phone or a clock and I'll say, hey, it's 7 o'clock or it's 1:20. We're going to take this off at 1:40. You got it? I make sure that they know that. So I told this athlete, and he had forgotten. It happens, right there after the match. Right? Anyway, we get to the restaurant, and the ice had been on about 50 minutes. And he gets out of the car, and I'm like, dude, you left your ice on. He's like, oh, man, oh, my gosh, I just got to talking. Anyway, he was like, my foot doesn't work. He had actually basically iced or frozen his peroneal nerve. And so he lost the ability to control his foot movement, his dorsiflexion, right? And his plantar flexion to an extent, but it came back. Don't get me wrong. It did come back very quickly, but he learned right away, man, when Aaron says 20, 25, he means it because there are some negative things that can happen. So 20 to 25 minutes. I put in here, this is my first little story. So I'm in the line at the airport and we're waiting to get on the plane. I don't remember where I was going. I probably was traveling with one of the sports teams or going somewhere because I was working on my PhD at the time. And I had been an athletic trainer certified for about 10 years. And these two ladies were talking about their son and he had just had surgery and had surgery from an injury. And she was like, yeah, the doctor said to ice, but we didn't keep the ice thing after surgery. So I'm not quite sure how much to do. And, I wasn't eavesdropping, but, they're talking right in front of you. It's like you hear them, right? And I was about to say, but I'm not one who like, my name is Dr. Wells and but somebody next to me did, a distinguished looking gentleman, probably mid-60s. Hello, I'm a doctor and I would like to tell you that you should ice for no more than 15 minutes, but you must put a very thick towel, and I'm not making this up, a very thick towel between the skin and the ice. And I wanted this, because I was dressed like this, I wanted to say, hey, I'm just a PhD student and this doctor is incorrect. And I didn't because I would never do that, but he was incorrect. Now, I admit that this is my educated opinion, right? I'm very leery, and I tell this to my students, when you go take a class or you go speak with somebody and they present themselves as the ultimate authority, be careful, right? I mean, yes, we have great professors and great teachers all across the world, right? But I'm always one who's like, hey, take what I say. Yes, I'm backing up with science, but find out for yourself. So I'm never one who likes to present like, oh, this is the exact right way. But I do feel very confident about my belief in the ice and how it can really help. And if you're icing over a wrap, right, or you're putting a thick towel in, hey, you need to increase your time. Right? The purpose of icing is to get cold. Now, having said that, this is why I say, you have to take everything with a grain of salt to an extent, right? It's because there are people that are allergic to ice, really, right? There's almost a caveat for almost everything. There are people that are allergic to ice and they can have hives and certain reactions. I, in my experience, have had one athlete who was allergic to ice. Guess where he was from? Yeah, it's from Canada. Yeah, for real. Yeah, he was from Canada. And at first I thought, no way. He's like, Aaron, I'm telling you, I can't do this. He had an injury to his groin and I had him in an ice tub. And he was going, Aaron. And I was like, stop being a wimp. Yes, it's cold. Anyway, he was yelling and I was like, okay. Anyway, I got him out and like he started to develop hives and I was like, oh, my bad. You must be allergic to ice. So you do have people that are like that, right? But it's very rare. And again, listen to your body. If your body if you start to have hives, if you start to have extreme warmth, if you start to swell, right? Then figure that out and figure out what's wrong. But the concept, because we have a very small percentage of the population that is allergic to ice, the concept that, well, therefore we can't ice anyone, I think is incorrect. And I think we can safely apply ice to the skin. And like I said, unless you're going over a wrap. Now, real quick, I don't want to get kind of lost here, but why would I ice over an ACE wrap? Well, the next thing is when we talk about compression, and we'll get to it in just a second. When we talk about compression, sometimes I like to leave that compression on, right? You can take the wrap off and ice, but sometimes you just leave it on because it's easier. I want to just real quick talk about another concept from the ice. Why do we ice, right? Most people ice because of pain. That's the most common reason why people think to ice, and I agree with that completely. Some people put the ice on, well, let's control the swelling. Indirectly, I think that it can help with that indirectly. A lot of people do it because mom and dad said so, or because that's just what you do, is you ice injuries. I'm here to tell you that icing right after an injury happens and 3 weeks later, your rationale is almost completely different. You may not realize that, but your body does, right? There's completely different purposes. So I want to talk about icing right after the injury happens. And it is because the reason I recommend icing right after an injury happens is because of secondary hypoxic injury. All of you are probably thinking, what in the world is secondary hypoxic injury? Well, let's talk about that. And we're going to get technical for about 3 minutes, so bear with me, but it really is cool stuff, right? You know, the more I learn about the body, one, the more of a nerd I become. And number two, the more I'm convinced that Heavenly Father created us and has developed this incredible machine that can help us recover. And ice does an amazing job of facilitating that recovery as well. So let's get technical for just a few minutes. When we sprain our ankle, right? This is perfectly good tissue. This looks like we got a couple of nerves, right, coming down in here. We have the blood vessels going through here, and these are the cells. Well, then we have an injury, right? Boom, we get hit, we sprain an ankle, something happens, and we get this disruption to a small portion of tissue, right? Soft tissue. Because of that, we start to get some bleeding, we get some clotting, we start to get pressure on the nerves, right? And that's why we start to feel pain. We have pressure as swelling starts to build, which can lead, of course, to pain. And this is the primary injury, right? Because we're talking about secondary hypoxic injury. What's the primary injury? My sprained ankle, am I getting hit with a softball? Am I getting punched by my brother, whatever? You know, that's the primary injury, okay? Well, we start to get, again, this bleeding because we have disrupted that area. The tissue got compressed to a level where we get tissue disruption. And our body, amazingly, starts to form a clot. We start to get a hematoma in there. And again, we start to get some nerve pain because of pressure, right? But the body is controlling that bleeding. Well, again, those cells were damaged. And because they're damaged, they start to change a little bit, right? We start to get a little bit of muscle spasm. The body kind of naturally defends itself. Have you ever wondered, like you get the wind knocked out of you, you get hit in the belly, you kind of immediately go to that fetal position. That's a natural protective position. I don't really have to think about that. My body kind of does that. When we sprain our ankles or our knees, a lot of times our body will tense up and kind of spasm because it's protecting. It's an innate, protective mechanism. So we get that spasm that's occurring. We get inhibition of muscular strength due to pain and due to this muscle spasm. A lot of times we can't quite move our joints because they're so locked up as a result, again, of the body trying to protect itself. And at the cellular level, we start to get chemicals that are released. And these chemicals play a huge role in my recovery, right? But they also play a role in what happens to the tissue around that initial injury. So again, we're starting with this initial injury. Well, then we start to get, because of the chemicals that are released, we start to get these changes within the cells around. And we start to get what we call hemodynamic changes or decreased, and in some cases, even a cessation or a stoppage of blood flow to a particular area, right? And so what started off as my initial injury now is, all over here. Now, remember, we're looking at this microscopically, right? So we're not talking about if I sprain my ankle, I have pain up in my hip, right? But we're talking about a small little area that can start to spread around a little bit as a result of the chemicals being released from cells, which have an effect on the blood flow to the area. So again, we start to get decreased blood flow. You can kind of see the blockage here as a result of the clot, as a result of these cellular changes, as a result of chemicals that are released from these cells. And that all leads to secondary hypoxia, okay? Again, what does secondary mean? It's the secondary injury. What was the primary injury? The ankle sprain. The secondary injury is hypoxia, which is lack of oxygen. These surrounding tissues here can't get the oxygen that they need because of these hemodynamic changes, because the body is not sending blood to that area anymore. When we have a leaky faucet, right, we don't turn the faucet on high. What do? we shut the water off, right? Or you close that faucet so you can't use it anymore because you don't want things spraying everywhere. And that's what the body basically does. So what happens is these surrounding tissues start to die because they can't get the oxygen they need, and that is secondary hypoxia. So what do? We ice the area. So the two examples I give, if you're accidentally working and you chop your finger off or a portion of it, what do? You don't put it in an envelope, you don't put it in your pocket, you put it on ice and you take it to the hospital in hopes that they can sew it back on. What does the ice do? It's preserving the tissue. So I'm reading a story. This is the one that really helped me make this true. And this is the story I tell to my students in class. It's in Reader's Digest. Reader's Digest, I know, sounds like an old person magazine. It's the perfect bathroom magazine, okay? What I mean by that is if you have to just sit down for a second, you can read a joke, you can read a quick story. If you're gonna be there a while, they have longer stories, okay? So this was a longer story, right? I'm getting into the story and I'm reading it, and it's a story about a little boy up in Wisconsin who 5 or 6 years old, fell into a stream and he was submerged for about 45 minutes. Now, this was in late fall, right? Like mid-November. And so the water wasn't frozen, but it was dang close. I mean, it was freezing cold water. They found the little boy. He was submerged for 45 minutes. He took him to the hospital. 6 days later, that little boy is running around like nothing ever happened. Now, don't get me wrong. They were still very, very fortunate. But they said, the police, the doctors, actually the doctor, not the police, said had that same incident happened in April as opposed to November, that little boy is more than likely brain dead. Why? Because the cold water protected his brain. It basically, he could not get oxygen. He was underwater, he couldn't get oxygen. The cold water slowed down that tissue's need, slowed down the metabolism, that tissue's need for oxygen, and therefore it preserved it. And that's what we're doing when we ice these areas. This surrounding tissue is not getting the blood flow it needs. So by icing it, we are slowing down the metabolism. We are slowing down that need, the surrounding tissue's need for oxygen, because it's not going to get it. And the ice therefore preserves that tissue until we can start to recover and get normal blood flow, right? So that is what secondary hypoxia is. So all the time you're icing your ankle, and you thought you were just doing it because you were supposed to, or you're doing it because of pain. And by the way, you are doing it because of pain. It helps with pain modulation. But the real reason that you were doing it is, or maybe the unknown benefit was you were preventing that secondary hypoxia. You were limiting that injury to that specific area. Okay. Now, I said icing like 3 weeks still works, right? We still want to ice it, but the secondary hypoxia and the initial reason for icing really is like these first 2 or 3 days. Right, once we get beyond that initial phase of injury, then we can start to ice, to help with pain modulation, right? But when we ice those first 2 to 3 days, we're helping with swelling, right? Because we're limiting the scope of the injury. We're helping with pain modulation, number one, because we're numbing the tissue, but we're again limiting the scope of the injury, and therefore we're going to get less pain because we're having less tissue that ends up damaged. So again, all of this together equals a faster recovery, simply because we iced in that initial stage, right? So after the initial stage, like, week 2, I think the ice is for pain, right? When people ice and they say, man, I still have swelling in the area, I need to ice it. I don't correct them, but I say, yeah, ice it, absolutely. I think that the ice is more almost exclusively for pain modulation. Now, how can I get rid of swelling? Well, I feel better, therefore I can move it more. That's going to pump swelling out. So indirectly, I'm still helping with swelling. But after those first 2 to 3 days, I really believe that the primary rationale for icing an injury is just for pain modulation. All right, so hopefully that kind of makes sense. I know it's a little bit technical, but I still just am so amazed by the body's response and its ability to recover. And I'm going to in just a couple more slides, I'm going to just talk real briefly about that inflammatory process. But let's get into compression. So we use compression to kind of control, contain swelling, right, if you will. It helps kind of keep the swelling into limited areas. A lot of times when we ice an ankle, we'll use like a horseshoe like this, right? And you can put one on the lateral side or the outside or the medial side, the inside. And what happens is you end up with an ankle that will look like this, right? Swelling here, but where is there no swelling? Around the joint, right? And what does that mean? That means I can move it faster. And if I can move it faster, I'm going to get more blood flow into the area. I'm going to recover faster. I equate it to like a door. So we have a door right there. If that door was to start to develop rot, I'd much rather the rot be like on the door, main face of the door, maybe around the window. If those hinges start to rust and rot, the door becomes worthless, right? So the more we can keep that rot away from our hinges, so to speak, the faster we're going to be able to recover. And again, if I can start to move my foot, that's going to assist in blood flow coming to the area. That's going to help me in a faster recovery. So that's one of the reasons why we do compression. A couple just quick little rules with compression is to remember that we want to start distal or towards away from the heart and work our way towards the heart, right? That's kind of how we do it. I recommend when you're putting the elastic wrap on to pull it and to put about 50% of the tension, not 100% and not no tension. I pull about 50%. And if that gets too tight, I tell them, hey, loosen it, but put it right back on, okay? I say don't skimp. Like this is not really doing much. What's going to happen here? Yeah, yes, it's kind of keeping it away from the ankle, but the swelling is going to go where there's no wrap, right? So that's why I say like if I'm icing a knee, I begin my knee wraps below my calf and I go all the way up to mid-thigh, right? If I just go right below the knee, I'm going to have probably quite a bit of swelling that occurs within the ankle. If I can start down by the ankle, I can really push that swelling away from the knee. Or if I'm icing the ankle, I'll start at the toes and work my way all the way up to the calf, because that's going to really help spread out that swelling. Again, these are the rules that I always give my patients or my athletes. After putting on about 50%, if it's too tight, go ahead and loosen it. It starts to throb, right? Again, listen to your body. Don't just try to be super tough. If it starts to throb and it's painful, loosen it, but put it right back on. Okay, you can take it off to ice, or you can just increase your icing time by 5 to 8 minutes or so. As long as you can feel that cold, put the ice on there. But then I also tell them to make sure that they have it on the next day. If they're going to shower, that's great. Take the wrap off, but immediately put it back on. And when they come in the next day, they better have it on, right? That's kind of my rule when it comes to these ACE wraps. And again, we start distal and we work our way proximal towards the heart. So if I were icing my elbow, I would start down by my hand and I would work my way up to my bicep. All right, last one with our RICE is elevation. And I think this is, again, a kind of common sense. One of the reasons when we jam our fingers, they get so swollen. And if you notice that, you ever jam your finger and it almost looks 30 to 40% bigger than the other fingers. Imagine if when you sprained your leg or sprained an ankle, right? It swelled up to almost, half of the size. And it does swell up, don't get me wrong. But we see that with the fingers. That's because our fingers are down, right? Our hands are typically down. We don't walk around like this, right? And if we did, after spraining our fingers, they look really, really awkward. One time, my state president in Texas, he was an FBI agent, true story, and he had suffered a laceration to an artery while having to jump through a window. And he had to be casted like this. It was actually, I beg your pardon, it was his left arm. And my dad was bishop at the time, and he made a joke about he wanted to just resustain some people so that the state president would have to keep doing this and be like, the field goal's good. So anyway, that's just my dad, yes, no. But he did, he opted not to, he said he was gonna do it, and he didn't. But the state president had to have his hand up because, you don't want the leaky pipes, the damaged tissue to start to accumulate fluid. So simply elevating the lower extremities does a really, really good job. Go home, you can elevate it. Yes, we want to elevate it above the heart, but even if you're sitting watching TV, just keeping it up on a chair is going to do a very, very good job of keeping that fluid that has a tendency to accumulate. So when I put the RICE, the rest, ice, compression, and elevation all together, I really am, helping myself recover that much more quickly. And the whole recovery process has a tendency to be significantly healthier. I talk about RICE again as the Corvette rule, right? When they designed a Corvette in the early 60s, like late 50s, they got it right. I mean, the Corvette hasn't changed that much because you don't change perfection, right? They didn't need to redo a whole new concept because they got it right the first time. RICE is simple. And sometimes we think, oh, it's too simple to be good. Sure, sometimes, there are deals that are too good to be true. I get that. But RICE, just because it's simple, doesn't mean it isn't effective. And it is very, very effective. All right, so I know that was what we got a few more minutes, so I'm going to keep answering a couple of questions. I won't take as much time as I did on RICE, but my ankle still hurts 6 months ago, or excuse me, I sprained it 6 months ago. It still hurts. Why does it still hurt? So let's look at the inflammatory response. Yes, I put this up there to be intimidating. The inflammatory response is a chemically mediated response. It's so cool how the body can recover. And make no mistake, the inflammatory response is not just for musculoskeletal injury, right? When I get sick, my body goes through an inflammatory response. There's 5 signs that my body demonstrates when I'm going through this inflammatory response, this recovery. Heat, pain, swelling, redness, loss of function, right? So when I sprain my ankle, right, it gets swollen, it gets hot, I can't move it as much, it's very painful, right? So I see those signs. When I get the flu, what is my heat? Fever, right? I get body aches. I can't move as much. I have pain, right? So this inflammatory response is not just a musculoskeletal response. It's throughout the entire body. We're going to address it musculoskeletally because that's what we're talking about today. But this is how the body recovers from, from basically any type of injury. And obviously, when we look at the timeline, you're going to see that this is the timeline more specific to musculoskeletal trauma. So we're talking about a three-phase response. My first response is called the inflammatory response. Remember how I said ice for those first 2 to 3 days? That's in that inflammatory response phase. That is when my body kind of starts to just initially recover, regroup, kind of figures out exactly what's wrong, and it immediately begins in those first few hours to start to lay down scar tissue. I just find that fascinating, that while it's still trying to assess what's wrong, it can already start to lay down scar tissue to help our recovery. Then we get into what's called the fibroblastic repair phase. And this is where we start to lay down a lot more scar tissue. We start to feel better. We get people that start to become a little bit more active because they're feeling better. They're working with scar tissue as opposed to great muscle tissue, right? But the body still starts to recover and we're doing better. The maturation remodeling phase, right? This is where we kind of finish. It can take up to 1 to 2 years. So when I have people tell me, why does my ankle still hurt after 6 months? I'm like, well, because you're still dealing with damaged tissue, right? The body can take up to about 2 years to recover on certain injuries, right? Now, does that mean that we don't play basketball or football or baseball or jog for 2 years? No, of course not. That's what a great therapist can do. They can read what the body does and know how far to push and when to pull back and keep you active and everything while we're going through that process, right? But the body, again, where it can get perfectly feeling comfortable might be 1 to 2 years. Saquon Barkley is a running back now he's with the Eagles, which I hate to, are you an Eagles fan? Just kidding. Yeah, okay. Sorry. So I don't want to, I grew up in Texas, so I'll just leave it at that, right? So Saquon Barkley tore his ACL, and he talked about, and by the way, he's not alone. You hear this with a lot of players. That first year back, they have a hard time trusting the body. They're okay, they can run, but they're not quite there. The second year, they're like, hey, I'm back. Hopefully they recover. I'm feeling great. And a lot of that's not just psychological. I think people think it's psychological. I think a lot of it is because the body just is, by the time it gets you all the way back, it can take a year, right? It can take, depending upon the level of injury, it can take a year or two, right? Depending on what was injured to get you all the way back. So the concept of, an ankle sprain still hurting 6 months later is actually quite normal. Okay. But again, don't get me wrong. I'm not saying you can't do anything for 2 years. Just expect that you might have some limitations mentally, but also physically. I think a lot of people think, man, I'm so mentally weak because I should be over this. Not really. I think you're being a little hard on yourself because the body does take time to recover. Some highlights of the inflammatory process, right? So we started with this adult crashes bike, and we get back into recovery, right? So some cool highlights, like I was saying, the body starts to lay down scar tissue almost immediately. I think that's just fascinating. Chemicals run the process, right? It's a chemically mediated response. I don't have to think about it. Now, there's things I can do to assist it, right? We talked about icing, diet, rest, rehab, right? I'm making sure that I'm with a therapist that isn't just relying on a cookbook. It's day 4, so do this. No, they're reading the body, not a book. And they're reading what the body can do, and they're able to know when to push and when to pull back. But our body does heal itself, right? And like I said, this is not just for muscle injury. This is how we recover from the flu. And some flus and some injuries take a little bit longer, and some, you can get rid of relatively quickly because the body is really so good at taking care of this. All right, we got about 10, 15 more minutes. I'll try to hurry. And I appreciate you staying with me on some of this. I know some of you have to go to class, so no worries whatsoever. I want to talk about why we stretch. To answer that, I think we got to think about what is our purpose, right? Because there's different types of stretches. So I see people doing this right before they're going to run. I see people kind of jumping up and down. We see people that are kind of doing a moving warm up or so. So like we have kind of what we call a dynamic stretch, which is what we see right here, or a dynamic warm up. We get, we stretch to increase range of motion to try to prevent injury. We stretch maybe to kind of wake our body up neurologically, get our nerves firing correctly. And I think all of those are great reasons. Don't underestimate how important a good warm-up is, right? To me, a warm-up is about getting your blood flowing, It's about loosening up muscles and joints. It helps get our energy systems going, right? It helps my body know, hey, you got to start producing energy. I'm about to be active. Okay. Our cars no longer need a warm up, right? Because our cars have fuel injection. Before fuel injection, you had to let the car warm up about 5 or 6 minutes, right? In the cold and stuff. Our bodies, while they are certainly more complicated and advanced than a car, we still kind of like that warm up period. And again, this just kind of helps wake us up neurologically. It helps our energy systems get ready to go. It helps increase blood flow. And my general rule is, you're warm when you kind of, break a sweat. Right now, I'm a big guy. I sweat in cold weather, right? So you got to take that into consideration. If you walk outside in New Orleans in the summer, you're instantly sweating. Okay. So when I say break a sweat, you want to kind of feel that the sweat is coming from activity, not just from, from the humidity outside. A dynamic warm up. So this concept, I always talk about Michael Phelps, where he sits there and he just does his arms. That's a stretch, right? That's a type of stretch. It's a dynamic warm up. To me, he's waking up his muscles neurologically. He's getting them firing. He's ready to go. Is he preventing injury with this? I mean, maybe, but that's not the real purpose, right? The real purpose is to get your muscles going, to get your body firing neurologically. He's not necessarily stretching to prevent injury. When we stretch to prevent injury, what I like to say is, I call it educate the muscle, not just stretch the muscle. When I stretch, it's not like taking a pair of sweatpants, right, and pulling them side by side, or pulling one leg versus the other leg, trying to stretch them like a cotton tissue. To me, stretching is about educating the muscle, and more specifically, the Golgi tendon and the muscle spindle. We call that a static stretch, where we hold for about 20 to 30 seconds. If you are willing, and you don't have to, but if you're willing, would you stand up, and we're going to just try and experiment real quick. We'll go nice and slow, right? But I want you to just kind of stand up, shake your legs for a second. We've been sitting down for about 40 minutes, 45. Shake your legs, and nice and easy. Don't do it yet until I say go. I want you to bend over, and I want you to stop the moment you feel the smallest, teeniest twinge of uncomfortableness. Okay? So as soon as and note where you are, and then come back up nice and slow so we don't get anyone to pass out. You ready? Go. Note when you feel it. Okay, pay attention and come back up. Okay, just come back up, nice and easy. Don't anyone pass out. If somebody said, hey, Aaron, if you get both of your hands on the ground, I'll give you $10,000. I'm going to find a way to get it done, right? But that's not stretching to prevent injury, okay? So what I want to do now is I want us to go down, and I'm going to count to about 20 in my head. And I want us just to, again, stretch. Don't hurt yourself. Just let your body completely relax and go as far as you can, nice and easy for 20 seconds. Ready? If you want to participate. Ready? Go. Just let yourself relax. Nice and easy. Let it keep going. All right, let's slowly come back up. We don't want anyone to pass out. Okay. All right, shake your legs back out. Now, do you remember where you first start to feel that twinge the very first time we did it? Now, this time I'd like you to go down one more time, and I want you to see how far you can go and see if you went further than we could even 1 minute ago the first time we did it. Okay, ready? Let's go see how far we can go. Okay, let's come back up. Isn't that amazing? Like, just with one, you can sit down now. Thank you. Just with one simple 20-second stretch, my guess is most of you increased your range of motion by an inch, if not more so, right? Just simply by holding it 20 seconds. So what did we do? Did we magically stretch, tissue like a cotton sock or cotton fibers? No, we taught our Golgi tendon and our muscle spindle, whose job it is to basically kind of protect us, or what I say, keep us from doing a premature contraction, right? Because that's what they are. They're tension receptors. They tell us, whoa, easy now, easy. We taught it by just simply holding it for 20 to 30 seconds. Hey, just relax. So I got this, I got this. And then when we went back down, the Golgi tendon, the muscle spindle had relaxed already enough to let us go even further, right? That is a static stretch. And that's the type of stretch that we do when we're trying to prevent injury, right? When we're trying to keep from a premature stretch. I have the extramural example. We're playing extramurals. We used to have a faculty flag football team that was a lot of fun. And we were playing this team, but if you could imagine, we would get beat an awful lot because we're playing against young, kids or students, right? And this kid who was my body type, right? So I appreciated that he was a center just like me. But in extramural football, everyone is an eligible receiver. So you snap it, you lay your block, and then you roll out for a catch. It's great offense. So this he's a big kid, and he catches it, and he's sprinting down the sideline. Nobody picked him up, and he drops to the ground, and he's immediately grabbing his hamstring. He had gone through, his body had basically, as he's sprinting down the sideline, again, very big dude, first time all game he had sprinted like that, and it was in the fourth quarter, right? His body wasn't ready for that. His body wasn't, ready to extend like that sprinting down the sideline, because up to that point, he had just kind of done these short little bursts, and his body said, whoa, 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 and it contracted right when he's trying to run, and he ends up pulling his hamstring. So again, that is why we try to do this static stretch. Now, you might say, well, how long, let me go back to that. How long does it last, right? When I stretch, how long do I last? Well, when we go, so anyone that travels in a car, like if you're going to Las Vegas, you're going to California, you're going to Idaho, your very first stop, or as soon as I'm done talking, you're going to stand up and you're going to immediately kind of stretch, right? We get out of the car, we stretch. That's because it doesn't last it doesn't last forever. Okay. The concept of use it or lose it is valuable. Like it is true. So, even though we're talking about the static stretch, yes, we can educate, but our education doesn't last forever. It's kind of like me with Italian. I went to Italy on my mission. I used to speak it like I spoke English, and I can still do it when I practice it, when I hear it, but I need to get back into it in order to, get my body to hear like that. That's kind of how it is with our muscles. So to educate them, we need to make sure that we're doing what's called a static stretch. And don't get me wrong, this is a great stretch when you're trying to wake up. Warming up is great. Moving warm up is great. But when we're trying to prevent injury, I believe the best stretch is a static stretch. So here's my 2 little tips. I told you that today I wanted to give you some tips to do for the rest of your life. One of them is every day, find a set of stairs and simply let your body relax, right? Let your heels fall down. This is going to help stretch your calves, your hamstrings. This is going to help the curvature of your back. It's going to help your arches from becoming too flat, right? This is just real simple. It allows us to stretch our Achilles. It allows us to decrease pressure on the muscles, right? Because we are stretching connective tissue. Do this once or twice a day, every day for 20 to 30 seconds. Are you guaranteed not to get injured? No, but I sincerely believe that just simply doing this every day can have a lasting effect, especially when we think about the kinetic chain, right? The movement on my feet affects the movement of my shoulders. I mean, it absolutely does. The kinetic chain is real. So by keeping healthy legs, I can have a healthier lower back. I can have a healthier, upper back. I mean, theoretically, I could decrease tension causing headaches just by simply stretching my gastrocs, right? For real, like that's how the kinetic chain can work. Another one that I think is a great one, a little bit more aggressive, is a piriformis stretch. So we have this, what we call Faber position: flexion, abduction, external rotation. Faber position. So you can see he's flexed, he's abducted, and he's externally rotated. What this does, or he and she are doing it, what this does is this helps release the piriformis. And the piriformis muscle is the muscle that basically kind of catches or pinches on the sciatic nerve, right? So if you get a lot of lower leg numbness and discomfort, it can come from a bunch of factors. But one of the factors is a sciatic nerve. So simply, doing a nice, easy piriformis stretch. And I admit this is an advanced stretch, right? Somebody that has really achy knees is going to want to be real careful. That's why I show it kind of sitting up as well. It doesn't need to be super aggressive, but simply doing this can help. And again, doing this preventatively. Doing this is just part of your morning routine or your nightly routine. You kneel down to say your prayers, do a little quick piriformis stretch, and then go to bed. It can help. Now, can I become too flexible? Yes, but I believe it will take some doing, right? There are people following injury where they do have capsules that are a little bit too lax, and they have shoulders a little bit too lax. But to be perfectly honest, it's going to take some doing. You just simply stretching, if you're stretching properly, if you're not just bouncing, like I said, if I put both my hands on the floor to win $10,000, yeah, I might hurt something, okay? But that's not a healthy stretch. If you're stretching statically, you're stretching, on the stairs, you're stretching and get out of the car, you're probably going to be okay, realistically. Yes, like everything there are people that stretch too far. There are people that ice too long, but I truly do believe that you can do it effectively. And this concept, again, of stretching, this use it or lose it, leads to the last concept I want to talk about today, which is the SAID principle. The SAID principle is specific adaptations to imposed demands. This is how a good athletic trainer or a good physical therapist becomes a great athletic trainer or a great physical therapist. They understand how to push the body. They rehab the body based upon the factors that the body is telling them, by reading what the body is doing, by reading the signs of inflammation, and not just because it's day 7. Now, don't get me wrong, you still have to pay it to, the body does need time to recover, and we do have certain timelines. But when you only rely on timelines, right? Or you only rely on pain, or you only rely on X and not X, Y, and Z, right? We limit ourselves. And for us to gain strength, for us to gain balance, for us to gain knowledge, we have to push ourselves. Is it comfortable? No. I mean, I don't, Grayson, do you like going to school? Yeah, exactly. He tells me every morning. But I know that him going to school is going to help him, grow and learn, right? And some people do love going to school, and that's great. But they may not like exercise, like getting on the treadmill. Oh, it's terrible. But you get good outcome. Now, the difference between us and Heavenly Father, because again, I believe this is an eternal principle. I believe the set principle is something that's true. The difference between us and Heavenly Father is, do we every now and then overdo it? Yeah. Do we every now and then have teachers who overdo it maybe, or do we overdo it ourselves and try to crush ourselves where we actually end up injuring ourselves? Yeah, we do. Does Heavenly Father? No. He knows how far he can push us. And I don't know anyone that says, oh, sweet, I'm loving these trials, or I'm loving these tribulations. But you come out on the other side so much better. And he perfectly understands how to use the said principle in our lives so that we can achieve our maximum. By the way, when I say eternal, I mean, this is something I believe that we will work with forever, right? In the eternities, we will continually have to be pushed and tried and tested. And that, just like our body, right? Just like Wolff's Law, when I have a fractured bone, I have to do rehab in order to build bone matrix up. And the body does rehab. That's why we don't, we used to cast people that had ACL recoveries for months and months and months, and they came back worse, almost worse than they were before surgery. We don't do that anymore because we understand recovery. Heavenly Father understands that perfectly, and he knows just how far to push us so that we can achieve our maximal ability. So my little thoughts, my things, thank you for letting me share some thoughts. Be active as much as you can, right? Be smart. And again, enjoy this place here at BYU, which has unlimited opportunity, right? I say that we're in a campus where we have really unlimited opportunity. A lot of times I only scratch the surface of the opportunities that we can get here at BYU. So I appreciate you being here, and I appreciate you letting me speak. And I say those things in the name of Jesus Christ. Amen.
Thank you everyone so much for coming.